In this demonstration, I'm going to show you how to chart an initial consultation for hyperparathyroidism in the waiting room solution system, as used in the New York Center for Advanced Parathyroid Surgery. Before we chart the encounter, let's look at the management of yearly calcium levels on patients followed for primary hyperparathyroidism. Based on the diagnosis of hyperparathyroidism, I have set up an alert that the calcium is checked at least once a year. Here we see the patient diagnoses included in the search. Here are the tests that we are checking if they've been performed in the last year. When we have our patient list, we can take further action, like ordering the tests. You can also send a message to one or all of your patients who are due for a calcium check. Alternatively, the system will automatically alert the patient through email, voicemail, or secure messaging system when they are due for their test if they have not been performed. Now let's chart the encounter for a patient referred over for management of recently diagnosed primary hyperparathyroidism. Here we'll use a template for primary hyperparathyroidism. This may be filled in by the provider or the medical assistant to ensure that the pertinent tests are obtained and are recorded before the provider enters the room. I'll record the most recent PTH, the most recent calcium, and the 24-hour urine calcium level. Now I'll add the relevant major symptoms. This patient has a history of kidney stones. There is no abdominal discomfort, and there is bone and joint pain. When the user is done with the template format, you can easily switch to the standard text format. Templated content is automatically included. Now let's record the pertinent review of systems. If there are no other positive findings, you can just click the Normal Review of Systems button to fill in your standard normals with the one-click feature. Now let's take care of medications. I'm going to write for a vitamin D supplement. All medications, including standard SIGs, are preloaded into the database. You can override standard alerts. Now I'll select the patient's pharmacy. The prescriptions can then be electronically sent directly to the pharmacy. Now I'll chart the physical exam. In this case, all exam findings are normal. Now I'll go to the Assessment and Plan page of the A default plan is automatically entered based upon the presumptive diagnosis of hyperparathyroidism, which was selected when charting the history. The plan is to order localization procedures and to check a vitamin D level, which has not been checked. On the Orders and Procedures page, the Intelligent E&M checker helps ensure you are coding to the correct level for your encounter. Based on the complexity of this encounter, it qualifies for a Level 4 exam. Now I'll order a hyperparathyroidism panel of tests. The panel includes intact PTH, ionized calcium, 24-hour urine calcium, and ultrasound and sesame localization studies. If a bidirectional connection with a lab, such as LabCorp, has been established, the orders automatically are sent to the lab. Alternatively, you can print the prescription or requisition for the tests. When the encounter is complete, you can view and/or print the note. Pertinent positives are bolded in red. After the note is completed, it can be faxed to the referring provider along with a standard cover letter. Images, once performed, can be easily saved and viewed from within the EMR. Because the system is web-based, your notes as well as access to images is available whenever you have an internet connection. This completes the demonstration of charting an encounter for the diagnosis of primary hyperparathyroidism within the waiting room solution system.